Joy here with Real Progressives. I'm so excited. Tonight I have Dr. Victoria Dooley. She is a Bernie surrogate for 2020, and she is a serious Medicare for All warrior. So thank you so much for joining me tonight. I'm so excited.
Thank you. Go Bernie.
So, first, we definitely want to talk about how is our guy doing. I just got an update. He got out of the hospital 24 hours later.
Yes, he's doing amazing. That comes as no surprise to me as a medical professional, and seeing how active he was and understanding the procedure. I had no doubt in my mind that he would be out and well soon. So it came as no surprise. Yeah.
So as a doctor, can you verify that it is quite common to have the stents that he had?
Oh, absolutely. It's quite common. And when you think about it, as active as he is, okay, so you can judge a person's cardiac status by how much they can do. So you could have a 20, 30-year-old who goes up and down the stairs of their house and gets short of breath. But somebody like our future President Sanders, who's go, go, go all the time, fly to California, fly to New York, fly to Vegas, all over the place. The fact that he had this event and they fixed it means that it wasn't something major. If it was something super major, they would have caught it a lot sooner. You got to think about, what is a stress test? If you have chest pain, the doctor wants you to have a stress test. That's they put you on a treadmill, they have you run, they have you go. His life is a stress test. So if it was something super major, he wouldn't have been able to go as much as he went. And I'm just like, oh my God, I'm just amazed at how much more energetic he's going to be. I can't believe it.
I know, it's so crazy. I'm like, man, he's doing 55 events a day with that, and now he's going to come back with his robo heart.
Before, you're definitely not going to be able to now.
Yeah. Oh my God. So exciting. It's also beautiful because we saw such an outpouring of love, even from people who aren't Bernie supporters.
Yes, we did. And he's just a wonderful person. And like I said, this campaign is about us. And really, how could you have bad feelings? I mean, people do, we know why. But to have bad feelings about somebody who has so many policies that are going to improve the life of all of us, it's not really something that the average person should want to do. We know why the billionaires don't like it, but every day, Bernie is for the working class people.
Yeah, absolutely. A viewer actually reached out and wanted me to ask you, a lot of our policies are, even Medicare for All alone. They wanted me to ask you, as a woman of color, how would Medicare for All affect African Americans, Latinos, and people of color specifically?
I'm glad you asked that question. So a lot of people will say, when I post about Medicare for All and health disparities, Medicare for All is not going to help health disparities. Well, number one, you're wrong. In the bill, Bernie Sanders' bill, he has an actual bill. He doesn't have a framework or just some thoughts in his head. He has a bill, a detailed bill. There's a section in the bill called Addressing Health Disparities. So anyone who says Medicare for All is not going to help health disparities, they're flat out wrong. They don't know what they're talking about. In the bill, he has a bill, not a framework. In the bill, there's a section called Addressing Health Disparities. Number one, anytime and this issue goes back to slave days and slavery. Okay, so we got free, and we have been trying as a people to get health care as a right since we were freed slaves. And there's been no time that's been given. And so how do you get all people of color to have health insurance? You insure everyone, because if everyone is included, nobody can be excluded. And what do you see from past? We've had all these policies, all these people in the center. Well, let's just have some means testing, and let's just expand Medicaid or help insure a little bit more people, which is fine. It's nice, but it's not the right thing to do. Anytime you've insured more people, there's still a disproportionate amount of the poor, Black and brown people, who remain uninsured. Even after the Affordable Care Act, some people call Obamacare, yes, some people got insurance that didn't have insurance before, but there's still a disproportionate amount of Black and brown and poor people who are not insured. People with Medicaid. If you make a little bit too much to qualify for Medicaid, you get kicked off. Not all states expanded Medicaid. So the only way to make sure that all people of color are insured is to insure everybody. So no, you don't just insure Black and brown people. You don't just insure brown people. You insure everybody. If everybody's included, nobody can be excluded. And prevention is key. It's crucial in a lot of illnesses. So if you don't have any insurance, of course you're not going to go get preventative services. Medicare for all, it's a public health issue. In the state of Michigan, we have a high incidence of hepatitis A. That's an illness that affects your liver, and you get it through contaminated food and beverage. So a healthcare worker who might not make a ton of money, probably doesn't even make $15 an hour because that's not the minimum wage. They're sick. They might not be able to afford to call off of work. They go to work sick, not realizing that it's hepatitis. And then we've had all these outbreaks at restaurants all around the state of Michigan. The public health issue, if you insure everybody as a human right, you make sure that when they're sick, they can get to their doctor because they're not freaked out and worried about the cost. So if they do have a contagious illness, we can make sure that it doesn't spread to the whole community.
Absolutely. And as a doctor, I'm sure you deal with patients all the time who say, well, how much would it cost if I do, take care of this?
Yeah. So how much will it cost if for things services that I try to offer them? I'm sorry.
Yeah.
So that is the most common question I get asked in the office. I mean, yes, people ask me about side effects. People ask me about alternative, but I swear, come hang out with me in the office one day. The most common question I get asked is how much is this going to cost? And that's frustrating for a lot of reasons. Number one, that shouldn't happen in healthcare in this great and wealthy nation. It should be a non-issue. It should be $0 for everyone. So that's the main reason why it's frustrating. The next reason is every insurance company charges different amounts. So I went to school for all these years. I went to training. So I have all this medical knowledge, but now you want me to know the prices of all insurance companies? It's impossible. Nobody could physically do it. You could have ABC and health insurance, and your neighbor could have ABC health insurance, but you have different employers, and your two ABC health insurances are going to allow different amounts to be charged for things. So it's absolutely insane. And it's heartbreaking because number one, I don't know. And number two, it should not be a question we have to ask in this country, just like every other developed nation in the world. And I have lovely medical student with me this semester, and she actually grew up in Canada. She's a smart young lady, and she told me, you know what, I'm getting the medicine part of this, but what I don't get here in the United States is this insurance and this billing and why things cost the way they do. It's just insane.
Wow. Scott Desnoyers joined us. Do you know Scott?
Hi, Scott.
You guys, Scott lost his son to suicide because his son missed a $20 payment for his depression meds.
Yes.
And he lost his son. Like, these are the stories we're hearing. We're hearing about this insulin. We're hearing about medication. And I mean, that's got to be, it's heartbreaking for us. So I can't even imagine as a doctor being, I mean, I know I've worked in insurance for 10 years, and I've had people, well, but what if I get it and it costs so, and it's just like, can I do a GoFundMe over the phone? I don't know,
It's insane, stories like that. It's just insane. And I said the other day, I used to be a doctor, but now I just, I go to work and I just hear horror story after horror story about how people cannot afford treatments, tests, medications, and things because of rising costs. That's basically the majority of what I do. And me being a primary care doctor, a huge issue, a part of what I do is actually mental health, right? Because our mental health and our physical health aren't these distinct things. So people need, they're working long hours and they're getting paid too little. They don't have unions. They can't, their employer's not going to give them time off. So they come in when they're sick. But what happened before they got sick? They were overworked and underpaid. And so that stress caused them to get sick. So I say, hey, I'd like you to see a mental health therapist, somebody who has a little bit more expertise than I in mental health, just to have somebody to talk to every week. And they say, I can't afford it. That's the first thing they say, because copays and deductibles, if you have a $50 copay or even a $30 copay, every time you see somebody and your doctor's telling you want to go once a week, that's $120 to $200 a month just to go talk to somebody to improve your mental health. So mental health, vision health, dental health, hearing aids, they're all related to health. It's absolutely insane in the US that some things are covered and some things are not. It's crazy. And then again, with the Affordable Care Act, since your premium's not coming out of your check, you have to mail your premium in yourself. And one minor emergency could set you back so that you don't have the money for that premium. And then you're canceled. And then they make you wait weeks or a whole nother month before they'll reinstate you, even after you pay. It's insane.
Absolutely. I don't know if you've gotten a chance to read Elizabeth Warren's Medicare for All, but she actually has mental health separate.
She does.
Which is
let me
ableist.
Let me be very clear. There is only one candidate in this race that supports a single payer, fee-for-service, Medicare for all system. And that's what we as doctors support. We want a single system because we have to eliminate this administrative red tape. Like I said, one insurance company might pay for this generic blood pressure medicine, but another company won't. We need one single payer. And a Medicare for all system needs to cover everyone. It needs to cover everything. And we need to not allow room for these private payers who they rob us. And as physicians, they can commit to burnout because they make our life miserable because they refuse to pay and cover for services that we need for our patients. There's only one candidate. So all these other candidates who, I support Medicare for all. You really don't. If you are not 100% behind a single payer system, you do not support Medicare for all. Medicare for some, or I don't care, Medicare for America, whatever you want to call it. Like I said, we need to call it Bernie Care or something different because people are hijacking it. So yes, I saw her website, and I think Warren is a likable person. But her mental health section said something about we're going to make sure that payers, plural, cover mental health. And I'm like, what is going on? With Medicare for all, everything is covered. We have a bill. We don't have a framework. We have a bill. Senator Sanders has a bill. Dental, vision, mental health, physical therapy, reproductive services. All of those are going to be covered. Medications with only a $200 per year out of pocket cost. All those are going to be covered. So again, she's a likable person for several people, and I understand why. But if Medicare for all is a huge issue for you, like it is for Scott, like it is for me, like it is for you, there's only one candidate who fully supports the single payer Medicare for all system, and his name is Bernie the Unbought Sanders.
I like that Bernie Care. I think we should do that because Kamala's got her 10-year plan that she says is Medicare for all. And what do you think about hers?
President Obama said, I'm going to roll out the Affordable Care Act over the next 10 years. I mean, who was president after him? It never would have happened. This is completely insane. It's laughable and it's sad because, Kamala, she can afford her health insurance, premiums, deductibles, copays, et cetera, et cetera. She can afford it, but everyday working people can't. So that's why it's just so, I just don't understand. Like, why are we listening to these wealthy candidates who can all afford their health insurance tell us what we don't deserve? Why?
Yeah, absolutely. And unfortunately, I forget the gentleman's name, but he had to be in his 30s or 40s. He was young, and he worked for the Hillary campaign and then the Kamala campaign, and he died. And they set up a GoFundMe for his cancer.
Was it the gentleman with the colon cancer?
Yes.
Oh my God, that was so heartbreaking. Can you imagine? It's horrible. Oh my God, it's so insane. So like I said, when Senator Sanders does those town halls, yes, they're heartbreaking, but me as a doctor, those are stories I hear every day. People, you get hardships. You miss one bill, and then you're about to be homeless because you missed rent once because you had a major catastrophe, like your car had a major repair. Then you have to pick between fixing your car and paying your rent. Well, if you don't have your car fixed, you can't get to work, so then you won't be able to pay your rent. So you fix your car, and then you get stuck in this vicious cycle. So we need to pay people more. We need to pay people a minimum of $15 an hour. We need to allow them the right to unionize. We need to ensure that they all will have jobs if they want it. Future President Sanders has a job guarantee, and you need to fully insure them all. We spend more on healthcare in this country, and we get less. And it's laughable because everybody says, "Oh, America's so great. The land is free. Yay, 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 yay. We're so great." But you can't afford healthcare. We're so great, but you don't deserve to get your student loans canceled because that's not fair to people who didn't get theirs canceled. It's just nonsense. We are great. We are wealthy. We can afford to ensure everyone has a human right, just like every other developed nation in this world.
Absolutely. Yeah, I kind of feel like if you're a candidate and you can't even help your employee who is dying of cancer, I don't trust you to help my ass. That's for sure. Oh my God.
All of those candidates can afford their medical bills. So why are we listening to any of them who are saying we can't afford everyday working folks? There's only one candidate who can't afford his medical bills, but is also saying, look, as a nation, we can afford everybody's medical bills because we can. This current system of healthcare that we have is not sustainable. We spend so much. Inflation, the rate of inflation for healthcare is greater than the rate of inflation for other areas. We cannot sustain this current system. People say, oh, Medicare for all, people are going to be rationing care. We are rationing care now. People are dying because they cannot afford their insulin. People are not going to the doctor because they don't have the money. So we are rationing now. We cannot afford to sustain this current model. So there's only one candidate who is saying a single payer Medicare for all system that's going to cover everyone for almost everything except for maybe plastic surgery might be the only thing that's not covered. But you're going to be able to get. Have you been to the dentist? You know how expensive they are. The dentist is like, I got a root canal. It's like, I can't afford this. What's going on? It's insane. So it's going to cover dental. It's going to cover vision. It's going to cover hearing aids. It's going to cover long-term care. It's going to cover mental health. And it's going to change the world. It truly is. It's not cliche. It's going to change the world.
And it'll also help with mental health. The depression will deplete in so many people.
Yes, it will. And like I said, I'm really a big proponent of a program called the partial day program. So when people are super stressed, and usually it's because they have all this work stress and, the employer's not accommodating, and then that manifests into some physical depression, anxiety, and some other physical symptoms. So I'm a big proponent of something called a partial day program, which is where you go, I put you off of work on short-term disability. You go every day from like 9 to 3, and you have intensive mental health help with counselors, psychiatrists, group sessions, individual sessions. So when I bring this up to people, a lot of times people aren't super excited about the idea when I bring it up, but everybody I've sent to it, they're like, oh my God, Dr. Dooley, thank you for recommending this to me. I got better. You get better so much quicker when you do this intensive everyday program. But if you have a deductible, these programs can run hundreds or thousands of dollars a day. So I have so many people that I want to get to this program and they can't. The last time I checked for a patient who was having a tough time, it was like $450 a day until they met their deductible. And then once they met their deductible, they still had a 20% coinsurance. So it's like nobody would be able to afford that except for the super rich.
Right. Who really don't need insurance anyway. A viewer named Julia would like to know, with single payer, who determines medical necessity?
What does she mean by medical necessity? Medical necessity for what?
I think pre-authorization.
There's not going to be any pre-auth. We're getting rid of that. We're getting rid of all that administrative red tape. So with the single payer, we're going to have a national formulary, a national list of medications that will be covered. And we're going to get rid of this prior auth paperwork, paper pushing stuff that we have nowadays. And that's how we're going to save so much money, because we're going to eliminate all this red tape. So the doctor, your doctor will be able to make those decisions of what to write and what's going to be covered. And that's really exciting. That's the way medicine should be. I shouldn't have to convince somebody who's not a doctor, has zero medical training ever in their life. I shouldn't have to convince them why my patient needs something. Asthma inhaler, super expensive. And, I think there's only like one generic, super expensive. You could be paying $250, $300 a month for your asthma inhaler just so you can breathe, just so you can feel like a normal human being and breathe. Can you believe that? Just to breathe, $250 a month. So at the beginning of the year, if you have a $1,000 deductible for 4 months, you have to pay for that inhaler in full. And so I had a patient with asthma, and she had been on numerous inhalers, and there was one inhaler that worked well for her that kept her off of steroids, which caused weight gain and mood changes and a whole bunch of symptoms. That kept her out of my office, every month, kept her out of the ER. But her insurance company wouldn't pay for it. And at the end of the day, after spending all this time, a whole day trying to find out what I could do for a prior auth, it was just like, oh, her employer, they just made the decision that they're not going to cover this medication no matter what. So ultimately, absolutely, as a doctor, I know what my patient needs. She knows what she needs to make herself feel better. But just because her employer, I guess maybe it costs $2, $3, $4, $5 more than the other inhalers, they just flat out refuse to pay for it. So in a single payer Medicare for all system, we're going to put the power back in your doctor's hands, which is putting the power back in the people's hands. So we're going to eliminate all that red tape.
Absolutely. Some of my viewers know, back in August of 18, I woke up one day legally blind, just overnight. Myopic degeneration is what I was diagnosed with. So I have to get injections in my eyes every month. It's as bad as it sounds. And each one is over $12,000.
Oh my God.
So 2 eyes, 12 months. And the insurance company was telling me they couldn't deem it medically necessary because it's rare and I'm only 40 years old. So I was getting bills for like $35,000 and they weren't letting me get other ones until that was straightened out. And I was like, it's a nightmare. It is an absolute nightmare. It's traumatic.
It's your fault that you're the age that you are. Like, things can't happen outside of the age of normal. It's just horrendous. I've had people who have been stable on medications for illnesses for a long, long time, including medicines for some really slow. Some cancers are kind of really, really slow and we call them indolent. And they've been stable on those medicines for a long, long time. Then all of a sudden, they either lose their job and they get another one with a different insurance, or sometimes they keep the same job, but their employer just negotiates with a different insurance company because it's cheaper for them. And so then their medicine that they could have been on for 5, 10 years and been stable and living and healthy, all of a sudden the new insurance company would say, oh, we don't pay for that. Like, what do you mean you don't pay for it? This patient has been on this medicine for years. This has kept them alive, kept their cancer at bay or whatever illness it is. And they just won't refuse. They'll just flat out refuse to pay for it. Or they'll say, okay, well, you have to answer all these questions and send us all these records. Well, if this diagnosis was made 10 years ago, we might not have access to the records. I had this situation with somebody who their insurance changed and they were stable on a medicine that they needed for a chronic health problem. But with the medication, the chronic health problem was completely under control. And so it took almost 4 months just to find all the documents that they needed to finally approve this medication. It's absolutely insane. And there's only one reason they do it. And it's because at the end of the day, they're protecting their bottom line, their pocket. It's a for-profit system. By denying you care, their shareholders and their CEOs, they get to buy another yacht. That's not the way healthcare should be. It's just not.
Absolutely. How do you feel about, big money in politics is an issue regardless, but as a doctor, how does it make you feel when you see somebody like John Delaney, who's running for president, has millions in healthcare? Right. Or do you think that, how does it make you feel that these people are actually being bribed on other people's lives?
Because trailblazers like Senator Sanders and other people, I feel like most of the U.S. is kind of viewing it that, hey, this is insane. And just based off of how many donors did we get? Did the Sanders campaign get 1 million donors before any other candidate in history so quickly in his campaign? So I think more and more of us are getting sick and tired of being sick and tired of the wealthy having so much and having so little, that we're starting to say, hey, this isn't right. And this movement is about all of us. And I think I feel the way most Americans feel. And that's why he got those $1 million, those million donations, way more millions of dollars. But that's why he got those 1 million individual donors, because as a nation, we are sick and tired of being sick and tired, while this handful of super wealthy people have it all.
Absolutely. I know you opened up for our guy recently. What was the feedback from people in the audience? Do they seem to care about Medicare for all the most, or
with Senator, the lovely Senator Nina Turner, future President Sanders wasn't with us when we were in Iowa and New Hampshire, and it was just amazing. And so we went to talk to several different groups of people, which was super cool. We talked to the students, and I love that they're young and they're passionate. And some of them were talking about how they have student health on campus, and the doctor, and one of the young ladies told us about how the doctor offered something. I believe it was a vaccine, and she was like, she wanted it, but she didn't know if it was going to be covered. So and then she said she went home and she's like, oh, why did I say no? I really do, think I need it, but you said no because you're a student and you're concerned about costs. That's understandable. Mm-hmm. And then we talked to some other Democrats who weren't all super supportive of Sanders. So many of them were, but not all of them. And we had a very productive discussion. So even though some of those individuals who were Democrats didn't agree with 100%, at the end of the day, they thanked us. They were hospitable, and they could see our side, and they appreciated the discussion and the points that we brought up. And then one of my favorite parts was we got to talk to some seniors. Oh, and I love my seniors. And there was a wonderful senior there named Patty. Hi, Patty! And she was so cute. She was diehard for Bernie, and she had a bicycle. And it was an adult-sized bicycle, but it was like a tricycle. I hadn't seen it, so it's like, have you seen a bike that's like a tricycle, but it's an adult size? And on the back, she had her little Birdie bumper sticker on it.
Oh my God.
So, and there, most of the seniors supported Medicare for all. But one of them asked, brought up that the fact that there's some seniors who are like, hey, we like our Medicare, we paid into this. Don't touch it, leave it alone. We don't want anybody else to have it. And so the majority of the seniors didn't feel like that, but she just brought up that some people felt like that. So I thought that was interesting. But the overwhelming vast majority of people agree that our health system is broken. They might not agree on all his other policies, but the vast majority of people agree this health system is broken. Nobody loves their health insurance. Some people liked it, but the people who like it are because it's better than others. I kind of like my health insurance, but you know why? Because I can see whatever doctor I want. People love their doctors. So if you have a health insurance policy like Medicare for All, which you'll be able to see your doctor, that's going to make you happy. If you can see the doctor you want. People love their doctor. They don't love their health insurance plan. And the deductible, even though I have deductible, compared to some other people, it's not as high as some other people. So yeah, I kind of like it. But what's better than having a low deductible? No deductible, And even after I meet my deductible, we still have the stupid thing called the co-insurance. What even is that? What is a co-insurance? So I pay my copay, I pay my deductible, then I have to pay this co-insurance. It's insane. And then you pay your premium. So right now we're paying for healthcare like 4 times. So that's why the average family is spending like $20-something thousand a year on healthcare, because you're paying for it in a bazillion different ways. You're paying out of your check. You're paying at the doctor. You're paying when you get discharged from the doctor and you have to meet your deductible. And once you meet your deductible, you're paying for this stupid co-insurance, whatever the heck that is. So we're spending so much and we're getting so little. So Medicare for All is going to be a tax break for the majority of Americans. It's going to be a tax cut because they will have one fee taken out for the health insurance. The average family is not going to be paying that $20-something thousand that they pay now. For people like me, my family, our taxes are going to go up. But that's okay because I'm not a jerk. I was going to say. I don't mind. Nobody loves paying taxes, but I don't mind paying taxes if I get something out of it. I live in Michigan. Our roads are horrible. Have you been to Michigan?
No.
Our roads are horrible. Potholes for days. I went through like 3 tires this winter because of potholes. So yeah, when I pay taxes, and I'm like, these roads are garbage. It's frustrating. But if I'm paying taxes and I can go to the doctor when I want and leave and not have a bill, my children had orthopedic injuries this year. Oh my God, don't break a bone. It's going to cost you an arm and a leg. Don't break a bone. So both of my children had orthopedic injuries this year that required like some casting and required some physical therapy twice a week for 4 to 6 weeks. You can see how those bills add up. So it's just insane. If I'm paying my taxes and I can go to my doctor and not have to pay anything, if I'm paying taxes and the roads are clear, if I'm paying taxes and nobody is homeless, if I'm paying taxes and my children can go to public colleges and universities and trade schools for free, yeah, I'm getting something for my taxes. So again, nobody likes paying taxes, but it's going to be Medicare for all. It's going to be a tax cut for most people. And I think people will appreciate the fact that if we have to pay taxes, because we all have to, that at least let's see something, some benefits for the good with our taxes instead of all of it going to the military.
Absolutely. And I think something, something I like to point out to people as well is the Medicare for all is kind of the crux of everything, because you're going to have less homelessness when people have less medical bills. You're going to have more people in school when you don't have to pay for it. You're going to have better mental health across the board.
Absolutely.
I mean, suicides are at an all-time high. And a lot of that is because people can't afford to get treatment.
Crippling debt. People can't afford to get treatment. And then, like I said, the Affordable Care Act, you're kicked off when you're 20, after you're 26. So if you have a chronic mental health issue and you're on expensive medicine and all of a sudden you're 26, then what do? You're just supposed to get magically cured or die or be homeless? It's like insane. So the Affordable Care Act, yes, it had some good parts to it, but it wasn't enough. When we initially had Medicare, when Medicare came out, it's Medicare for seniors now, people with chronic kidney disease and some other chronic issues. But the point of Medicare was always supposed to be as a universal health system to cover everyone. But what happened? The same thing, history repeats itself. The same thing that's happening now. Big people who make a ton of money, people who were racist and didn't want everybody to be insured, because if everybody's insured, guess who's going to be insured? Black people, brown people, poor people. So people who did not care about Black and brown and poor people. And then the AMA, the American Medical Association, they all came out against it. So what's happening now with all these millionaires and special interest groups coming out against it, it's nothing new. But I think the difference this time is going to be, we're going to stand up because of this campaign, because of this movement, and we're going to say, no, we're sick and tired of you keeping us sick and tired. And we are going to stand up for what's right, and we are going to vote for the politician who's going to make our life better.
Absolutely. Yeah, I'm not sure if you saw this, but Elizabeth Warren, she wants to cap prescriptions at $500 a month. Now, that's still $6,000 a year. So there are too many people who can't afford $100 a month.
No.
So what's your
asthma inhaler could be $250, $300 a month. It's insane. It's ridiculous. It's not Medicare for all. So with our Medicare for all system, it's a $200 per year cap. So what is that? $15 a month if you average it out or something like that. Mm-hmm. So $200 per year. And that's all. $200 per year versus which 6,000. So a 6,000 having to pay $6,000 a year is the equivalent to, you have a high deductible plan. That's not Medicare for all. That's a high deductible plan that everybody has now, and that's why people die, because of these high deductibles. So basically, yeah, if you get hit by a car and we have to use hydraulics to get you out and you're comatose and rush you to the hospital, then, instead of $100,000, $200,000, maybe you're paying $5 or $10. But still, for people to get preventative care that they need, for people to get their asthma inhalers, for people to get their insulin, that is way too much. That is not a Medicare for all system. That is a high deductible healthcare plan.
And that's just privilege. Honestly, look, it's a bargain. $500 a month. It's like, You're
Yeah,
definitely a millionaire.
politician, that seems reasonable, but that's out of touch with the everyday people. Like I said, I see this every day. And you have to look, you look at all, I love Senator Sanders because all of his policies, they just go together. Medicare for all alone is going to decrease poverty by 20% because a lot of people are in poverty because they have all these medical bills, right? So Medicare alone for all is going to decrease poverty by 20%. We're going to make sure that jobs, everybody who wants a job has a job. So we're going to have a jobs guarantee. We're going to make sure everybody can have a house. So all these policies just go together hand in hand. So it is a level of privilege to think that people can afford $500 a month. They can't. This is what I do every day. They can barely afford to come see me. And then we have these plans where, oh, it might cost way more than $20 to see me, but $50 to see your specialist. So I do everything as a family medicine doctor because I like the variety, but I have to. Because if I can save my patient that $50 by doing their mole biopsy or injecting their knee, I'm going to do that for them because I'm very mindful of people's costs. I was trained in Detroit and Flint, Michigan. So a lot of my patients in my training didn't have these super fancy, great health insurance plans that these wealthy politicians have. And so I had to learn how to do a lot with a little. So I'm very hands-on. I do as much as I can to help my patients, but I need more help, Joy. I can't do it all. I can't buy everybody's insulin. I can't. I don't care how much money you think doctors make. I do not make enough money to buy all my asthmatics insulin. Buy all my diabetics insulin, buy diabetic patient insulin, to buy all my asthmatic patients inhalers. I don't. If I did, I would, because this system is insane. And so people cannot afford it. I had a lady who had diabetes, and I hadn't seen her in like 9 months. We kept calling her, because, I just want to know, are you okay? If you find another doctor, that's fine, but I care about my patients. I'm a very hands-on doctor. I'm very possessive of them because I love them. And finally saw her back after about 9 months, fell in some hard times. Husband became unemployed. So basically, they just couldn't afford anything. And instead of just letting me know, it's embarrassing to admit that you can't afford certain things. So I had been off their insulin and everything for a long time because they just couldn't afford it. And so now I'm stuck in this position like, oh my God, what can I do to help this individual? They can't afford their insulin, but they absolutely need insulin. There's cheaper medicines that I can give them, but they're not going to do the same job that the insulin is going to do. And so that's why people ration, and it's heartbreaking. When I go to work to help people and help them accomplish goals. And yeah, if I told you I want you to exercise more and your blood pressure come down and it doesn't, I still want to see you. I still love you. I want to give you that pep talk again. But the most rewarding part of my work is when people are able to follow my instructions and to be healthier. And too often now they can't because of cost. They want to, but they just simply can't afford
it. And that's what's so heartbreaking, because the inadvertent neglect is what exacerbates bigger problems in the future.
It does. So prevention is key. If you can't get in the doctor when you're feeling a little bit under the weather and you let it go and get worse, then prevention is key. We know that. Early detection is the key. So when people get colonoscopies, people don't understand. By getting a colonoscopy, hopefully you don't have colon cancer. Hopefully the worst case we find is precancerous polyp. And by getting the colonoscopy, we cut out that polyp, we stop colon cancer and that precancerous polyp from happening by cutting it out. But some people will tell me, well, yeah, the colonoscopy might be covered, but I'm worried that if they find colon cancer, I'm not going to be able to afford the treatment of it. And then, that's so heartbreaking. What do you say to somebody who says that to you? Like, I want my colonoscopy. I want to be screened for colon cancer, but to be honest, if I have it, I can't afford it, so never mind. That's the kind of healthcare system that we have in this country. And I'm just super excited about the fact that we're going to change that in 2020.
Absolutely. I think when I worked in a call center for medical assistance, one of the worst calls I've ever taken in my life was this. I heard this young man screaming in the background, and it was a woman crying, and she said, "My son was just stabbed. I'm scared if I take him to the hospital, they're not going to see him. He got stabbed 3 times in the stomach." And I could hear him moaning and screaming. And I'm just thinking, oh my God, this woman is terrified to take her kid. And I said, please, please, please just take him. We'll figure it out. Medicare or Medicaid is 90 days retroactive. Get him there. Call back. As for me personally, I'll do whatever I can.
Mm-hmm.
But it just broke my heart because she was hysterical.
Right.
She's like,
and it's horrible. It's horrendous. And most people wouldn't have been as compassionate as you are. But I hear these stories all the time. I have to call people when I think something major is going on and tell them I have to go to the ER. And their first response is like, I can't afford it. There's just certain things I can't do in the office. If I think you have appendicitis, I've had several people with pain in their right lower quadrant of their abdomen, super fever, super tender. When I press over their appendix, I'm like, you probably have appendicitis. I don't have a CAT scan in my office. I don't have any way to figure this out. We got to figure this out now before like ruptures. And they're like pleading with me, is there any other way we can go about this other than going to the ER? And it's not. And it's just so sad. But, you know, there's a better way. We know what it is. It's a single payer Medicare for all system, what we're going to call Bernie Care now. And it's going to cover everybody. It's going to cover everything except for maybe cosmetic services. When you go to the doctor, when you go to the hospital, when you go to the ER, you're going to leave and pay zero. You might have to pay for parking. You might have to pay for snacks. I don't know. If we have any money left over, maybe we can throw that in the bill. But when you leave, you're not going to have to pay anything for your Medicare costs. And that should be the way it should be. If you're sick, you know, you got to pay your doctor. You got to pay the lab. You got to pay the facility. But at the end of the day, if there's any change left, it shouldn't be some rich jerk, you know, sailing around in this yacht with your change. That's your damn change. That change should go back to you so that when you get sick again, it's there. And so that's what this Medicare for all pool of money is going to be for, to take care of everybody when they're sick. And at the end of the day, no one's jacking up prices and refusing to do the care they need because they want to take that your change and pocket it and be wealthy because of your sickness.
Absolutely. We have a viewer who wants to know if things like acupuncture would be covered.
To my knowledge, and I will check with the team again. Last time I checked, to my knowledge, it's not at this time, but we are looking to see if we can add some of the alternative treatments that are known to help. I think acupuncture is great. I've had it done several times. So we're going to work on that. I can guarantee that.
Is there anything else you would like to add?
I think we covered it. You asked some great questions. I'm glad you brought up the health disparity thing. Again, as a person of color, we know that people who have health insurance have better outcomes. Who have health insurance as affordable. So if you have health insurance and you have a $5,000 deductible, it's like not having health insurance. But we know when people have affordable health insurance and when there's doctors in their areas that they can get to, it's going to help them. Also, Senator Sanders has plans to fund HBCUs because doctors of color are more likely to practice in areas where their patients are of color. They're more likely to practice in those areas. So he has a plan to increase funding for HBCUs. He has a plan to get more Black doctors of color graduated, and to eliminate some of this financial burden off of them so that we can get more people covered. So Medicare for All is absolutely going to help with health disparities. It's going to be all inclusive, and when you go to the doctor, you're going to have to pay nothing, and except no substitutes, no middle ground. There's only one candidate who has a single payer Medicare for All system. We have to eliminate the private insurance company. They're gone. So if any candidate is leaving room for these private insurance companies to hang around, they're bought. They're bought. So I wouldn't listen to anything they say, because the only justification for keeping a private health insurer in the mix is because they're funding your campaign. There's just no other logic to it. They do not take good care of you. At the end of the day, they take care of themselves. So if any candidate is allowing room in their plan to keep these private payers around, they don't give a damn about you.
Absolutely. So when people come up to you and say, why is Bernie Care the best? Why do you say, give me your elevator speech?
Bernie Care, a Medicare for All, single payer Medicare for All plan is the best for me as a doctor, because it's going to eliminate these prior auths and insurance red tape. It's going to eliminate me having to argue with somebody who's not a doctor or provider to get you the care that you need. It's good for you because you're going to be able to get mental health, digital health, vision, physical therapy. You're going to be able to get all these services and pay nothing. And for most people, it's going to be a tax cut. Actually, it's going to be a progressive tax system. So people who make more money are going to have to pay more in their taxes, but the average American is actually going to pay less. And honestly, Senator Sanders is the only person who supports the type of single payer system that doctors like, that 50% of doctors support. So he has a damn bill, and Jayapal has a damn bill for Medicare for all. We don't have any framework. They both eliminate private payers. And so he's the only presidential candidate who has a bill that's going to allow you to go to any doctor you want, any hospital you want, any physical therapist you want, any eye doctor you want. Go get your hearing aid from wherever you want, and have to pay $0 when you leave. So,
absolutely. So, what would you like to leave our audience with? If, let's say, somebody's undecided on candidates, or kind of undecided on, who Medicare for all, what is something you want our audience to take away?
I want them to understand that this nation is wealthy enough to make life better for the common, everyday, average folk. And out of all these presidential candidates out here, they all have homes. They all can afford to pay off their college debt. They all can afford their hospital bills. So if you have difficulty with any of those things, you might not have difficulty with medical bills, but you might have student loan debt, or you might be your rent might be too high. You might want to or you might have difficulty finding a job, and you might want jobs guaranteed. If you look at all these candidates, I urge you to consider the candidate who is for you, who's going to improve your life. Because remember, all these candidates can afford all these things. So why are we going to listen to a candidate who says, yeah, I can afford my several houses and I can afford to pay off my student loans, but you know what? I'm going to cherry pick which one of you that we're going to help afford it. Why not go for the candidate who says we can afford to make America better for everyone?
Absolutely. And you guys, I don't know if you caught the beginning, but Bernie has been sent home. So yeah. And
before, get ready.
That stinker was tweeting from his bed about Medicare for all, and he was thinking about everyone else.
About his time to me. That's just the type of person he is.
I know. Oh my gosh.
Dave, the missus, is gonna make sure he takes a few more days of rest, as would I. Understand his position, but I think he's been doing as much as he was doing with a minor clog, and now it's unclogged because it's dented, and he's going to be even better than before. So
I know. I can't wait. And I also want to thank all you guys who have been blowing up my Twitter. For those of you who haven't seen, I'm in Pennsylvania, and I got laid off Friday, and I made the decision to apply for a Bernie position in New Hampshire, which is crazy, but I don't want to wait till we start in Pennsylvania. So, and Ro Khanna, Congressman Ro / co-chair, is offered to be one of my references. So, so hopefully you'll be seeing me in New Hampshire knocking on doors.
And hopefully I'll come back out and join you. I love New Hampshire. I had a great time.
Awesome. It is beautiful. Thank you guys so much for watching. This was such an important show because I talk about these things, but I'm not a doctor. And I know a lot of people are like, whatever, you love Bernie, you're going to say that. But no, it really is true. Now you have a doctor saying it. It's true. He's the best.
There for all. We're working on the other one. So.
Awesome. Thank you so much. I cannot thank you enough. And I see some love for Nina. Last time I met Nina, I told her straight up, Burn Intern 2020, you tell Bernie, I'm not messing around. She's our VP. I'm not playing. I don't want anyone else.
Yeah.
Nina. Well, thank you so much again. I appreciate it. Best of luck. Take care with everything.
Thank you.
Bye-bye. Thank you guys for watching.